How do you even diagnose it? How do you treat it? Kind of how do we think about things kind of maybe once you develop liver cancer? So liver cancer is usually diagnosed by imaging, really. In people who are at high risk, especially those with cirrhosis, we can diagnose liver cancer by imaging alone, which people are very surprised at. So the majority of patients that I work with, especially as a transplant liver specialist, we diagnose a liver cancer without even a biopsy. It's diagnosed based usually on CT scan and MRI scan. So an ultrasound is what we do to screen for liver cancer. So basically, if you have these risk factors, your doctor may screen you with an ultrasound. If you have cirrhosis of the liver, the recommendation is that you get surveillance so that you're getting an ultrasound with an AFP, that's an alpha fetoprotein, that's a tumor marker for liver cancer, that you get both of those every 6 months when you're at very high risk of developing liver cancer. Then to make the diagnosis, as I mentioned, we do a CT scan or an MRI. You're usually going to get blood tests as well, like a complete blood count, comprehensive metabolic panel that looks at your kidneys, your liver test, your liver function, the hepatitis panel, because again, you want to see if you have hepatitis B or C, what is putting you at risk for liver cancer. And then there are other tumor markers, like I mentioned, the AFP, that can be used to screen for liver cancer. There will be some people who do need biopsies if the imaging isn't classic for liver cancer, or the person is not thought to be at high risk for liver cancer, but we see a liver lesion, then sometimes we will have to biopsy to make the diagnosis. But a cure may be possible if liver cancer is detected early and removed by surgery. And that's why we've talked about this. Finding these cancers early and at an early stage is definitely life-changing. So you want to talk to your doctor about being tested regularly, especially if you have risk factors that we've talked about. So how to determine the liver cancer stage? So when liver cancer is diagnosed, then we have to figure out just how serious it is. And we do that in a process called staging. So there are two parts of staging in liver cancer. And the reason why there are two parts is because liver cancer also results in from liver disease, where that can be affected by how the liver is actually working. So the first part of staging is determining like how big is the liver? What's the size of the liver? Is the cancer spread outside of the liver? If it has spread outside the liver, to what body parts? And what's interesting about liver cancer is that I'm often more worried about spread within the liver, like how much cancer is in the liver to stage, sometimes more than I am about it moving outside of the liver. Because it usually takes a while for the liver cancer to move outside of the liver. But if there's a lot of cancer within the liver itself, then that also means that you're a more advanced stage. So the next part of staging is, what is the liver function? Because right, we said often people get liver cancer because they have cirrhosis, and cirrhosis affects how your liver functions. And if your liver is not functioning, you can have ascites or fluid in your abdomen. You can start turning yellow, or called jaundice. You can get confusion. We call that hepatic encephalopathy. You can have big blood vessels in the esophagus called varices. So there are a lot of signs and symptoms that can come from liver failure. If your liver is functioning well and you don't have any of these, or if you have mild aspects of these, you're what's called class A. If you have mild abnormalities that are more present, when you look at labs or look at someone on an exam, then that's class B. And if you have more severe abnormalities of liver dysfunction, that's called class C. Most of our treatments are really going to be for those who are class A, with the exception A and maybe B, with the exception of that being people who get liver transplants, because certainly one of the main reasons for liver transplant is because the liver is not working. But another big indication for liver transplantation is liver cancer. So this is the three general stages of liver cancer. There's early stage, where it's resectable or transplantable, and that's what you want. If you're identified early, where there's not a lot of tumors, or the tumors are smaller in size, then if you don't have cirrhosis, or if your liver is functioning very well, you could just have the cancer removed by surgery. But I will tell you, most people don't have enough good liver left to have the cancer removed by surgery. Most people have to have a transplant. So they need the whole liver taken out, and then they get a whole new liver. And that's the best and most likely curable option. Often I find people are not referred early enough to a liver specialist like myself, to make sure that they know transplant is the best curative option. And sometimes they're treated with all kinds of other things that we'll talk about, in these next slides before they're offered transplant, where transplant is usually going to be the best and most curable option if it's early stage. If it's intermediate stage, meaning the liver cancer is not really resectable by surgery, but it's not outside of the liver, then that's when you want to think about other options for treatment. So these patients are unlikely to be able to have surgery and are unlikely to be treated with a liver transplant. Sometimes when you're in intermediate stage, you can be what we call downstage to then where transplant is possible. And you're downstage with local therapies that we'll talk about in upcoming slides. Then if you have advanced cancer, this is liver cancer that has usually spread to lymph nodes or other organs, or if it's advanced, if you're very decompensated or class C, like we talked about, and there's also extensive cancer within the liver. So treatment with surgery is not likely, and these individuals are unlikely to be downstaged.